And good questions. 3D insole and a traditional one or classic insole, both has different. 3D is very latest technology, and which is 100% computerized, as I know. So it's printed, we took the pressures and then we scan it, the food, and then we put all data to the computer. The software is there. We make the modifications by computerizing and software, that particular software, and then we transfer that whole things after modification to the 3D printer machine, and then they start. This is totally machine and computerized insole, which give more comfortness and more correction to the patients. As far as regarding the classic one is very old. This is PP. We can make polypropylene insoles, which is partial handmade and computer made, pressure made. So in this way, in this classic one come 90%, 80% benefit to the patient. But 3D is coming 99%. I can give 99% corrections and comfort level to the patient.